The psychology of virtual reality, why it's so immersive. The world of virtual reality, VR, has exploded in recent years. From gaming and entertainment to healthcare and education, industries are utilizing the immersive experience that VR provides. The question is, why is VR so immersive? The answer lies in the psychology behind it. Presence. The most significant factor contributing to the immersive experience of VR is presence. Presence refers to the user's sense of being present in the digital environment. The degree of presence can vary, depending on factors such as the quality of the VR device and the nature of the digital environment, but ultimately, presence creates a strong sense of immersion. Presence is achieved through a combination of sensory inputs. VR devices provide users with visual, auditory, and haptic, touch, feedback, which together create a multi-sensory experience that feels believable. The motion tracking technology used in VR devices allows users to move in the digital space, further enhancing their sense of presence. For example, a VR game that simulates rock climbing can provide users with a convincing sensory experience. The user's grip on the rock, the feeling of wind blowing in their face, and the surrounding vista contribute to a high sense of presence. The user can look around and experience the environment as if they were actually there. The sense of presence created by VR is not simply a byproduct of better screen resolution or higher frame rates. Presence is a psychological state that emerges when the inputs provided by a VR device align with our senses and create a convincing sensory experience. The illusion of embodiment. In addition to presence, VR provides the illusion of embodiment. Embodiment refers to the sense of being in control of a body within the digital environment. In a well-designed VR environment, users experience the illusion of embodying an avatar or digital representation of themselves. The brain is programmed to quickly adapt to the experiences presented to it. In VR, when users observe their digital body, the brain can be tricked into believing that it is their own body. The brain will accept the digital self as a legitimate representation of the physical self, leading to a higher sense of immersion. The illusion of embodiment can have a significant impact on the user's behavior. Studies have shown that users will be more likely to act in the digital environment as they would in the physical environment. The way that users feel about their digital bodies can also be transferred to their emotional state in the physical world. For example, a study conducted by researchers at Stanford University found that participants who experienced themselves as taller in VR were more confident and assertive in real life. The illusion of embodiment can be powerful, and developers must be aware of the impact it can have on users. Agency. Finally, VR provides users with a high degree of agency. Agency refers to the sense of control that users have over their digital environment. In VR, users can interact with the digital objects in their environment, moving them and manipulating them. This degree of control can create a high sense of immersion. Agency is achieved through the use of controllers or motion sensors. By providing users with the ability to manipulate digital objects in a convincing way, developers can create an environment in which users are active participants, rather than passive observers. For example, a VR training program for medical students could feature a virtual surgery in which students use controllers to manipulate surgical tools. The sense of agency that results from this interaction can create a more effective learning experience. The impact on mental health. Virtual reality's immersive experience has resulted in the technology being explored as a tool for mental health treatment. Exposure therapy involves exposing patients to situations or stimuli that cause anxiety or fear, with the goal of helping them overcome their anxiety over time. For example, people with a fear of flying can be exposed to a virtual environment that simulates an airplane trip. VR can create a highly convincing environment, allowing patients to experience the anxiety-provoking situation without having to be physically present. Exposure therapy using VR has been found to be effective in treating anxiety disorders such as phobias and post-traumatic stress disorder, PTSD. Another use of VR in mental health is in the treatment of chronic pain. Studies have shown that VR distraction therapy can help alleviate pain by providing a more immersive experience that allows patients to focus on something other than their pain. The immersive experience of VR can also have positive impacts on mental well-being. Studies have shown that playing VR games can improve mood and reduce symptoms of anxiety and depression. In addition to mental health, VR has potential uses in various industries, such as education and training. VR training programs can allow learners to engage in realistic simulations without the risks associated with traditional training methods. For example, airline pilots can practice emergency procedures without putting themselves or others in danger. In the field of education, VR can provide students with immersive learning experiences, bringing them closer to the subject matter. A VR field trip can transport students to a different time period or location, allowing them to explore and learn in a more meaningful way. VR can also be used to provide students with hands-on experiences that would be difficult to replicate in a traditional classroom environment. However, as with any technology, there are potential drawbacks to VR. Extended use of VR devices can lead to a variety of physical symptoms, such as eye strain, headache, and even nausea. Developers must take steps to minimize the risks associated with VR use and ensure that users are made aware of the potential risks. Privacy is also a concern when it comes to VR. As VR technology becomes more advanced, there is the potential for it to collect sensitive information about users, such as their movements and behaviors. Developers must be transparent about the data collected and must take steps to protect user privacy. In addition to the potential benefits and drawbacks of VR, there are also ethical considerations to be made. As VR becomes more realistic, there is the potential for users to experience simulations that involve violence, sexual content, or other morally questionable content. Developers must be mindful of the potential impact of these simulations on users and ensure that appropriate safeguards are in place. One solution is to implement content rating systems, similar to those used in the video game industry. This would allow users to make informed decisions about the content they experience in VR. Another ethical consideration is the potential for VR technology to exacerbate existing inequalities. For example, if VR training programs become the standard for certain jobs, those who do not have access to the necessary VR equipment may be at a disadvantage. It will be important to ensure that access to VR technology is equitable and that those who do not have access are not left behind. Finally, there is the question of the impact of VR on social interaction. As VR becomes more immersive, there is the potential for users to become isolated from the physical world and from each other.